Now, if you're actually suspecting that a patient that's like a newborn baby has neonatal sepsis, one of the laboratory tests that is usually useful is you trying to dictate inflammatory markers in the blood. Of course, sepsis comes with what? Inflammation, because there's a lot of cytokines released, that's pro-inflammatory ones. Yeah, anti-inflammatory ones are released, but the pro-inflammatory ones are way more than the anti-inflammatory ones. Do you understand? So of course, the highest vote takes. So you are having more of inflammation. So for the neonatal sepsis, we say that it plays a vital role in early the inflammatory markers. If you are trying to pick them up, of course, it will help you to early on, all right, dictate the sepsis, to be able to diagnose it, to be able to keep monitoring it. Okay, so because clinical signs in newborns are often subtle, so they are non-specific. You can't really there are so many other disease conditions that, let me say, one of the highest sign of sepsis is the newborn baby is having difficulties in breathing. Of course, pneumonia can cause that. Acute respiratory distress syndrome can cause that. Do you understand? So you want to do all these tests so that it can be very, very specific about the diagnosis. So inflammatory markers you look out for is things like C-Reactive Protein. So usually the levels should be going up within 6 to 12 hours after the infection. Use is good for monitoring disease treatment response. Okay. Limitation can also be elevated in other conditions like meconium aspiration syndrome if there's birth trauma. Okay, so you don't really rely only on it. Okay, you have to further go for other ones. Then procalcitonin rises between 2 to 4 hours. It's more specific. If you see it, you are very sure that there's a bacterial infection. Okay, can also be elevated in birth asphyxia. Okay, so interleukins 6, 8, all of them also help. Tumor necrosis factor alpha indicates that there's like a systemic inflammation. Okay, so limitation is short half-life, so it comes and goes quick. All right, so you have to be quick about it. CD64, CD11B, okay, promising for rapid diagnosis. Then imagine and combine marker strategies. They usually combine this, to be very sure. Okay, so that's what we have for the different markers. Inflammatory markers you're actually trying to look out for in case you are suspecting neonatal sepsis.